Your state is somewhat of a window into the reality of health care. You've been pictured at your desk with a big knife, having to cut the budget. Over $1 billion in health care cuts. It's going to affect low-income families. It's going to affect the coverage that children get. Is this absolutely necessary?
Well, you know, when you have a $26 billion shortfall in revenues, then you have to go and do a combination of things. And one of the things you have to do is make deep cuts in various different programs. But the important thing at the same time is that the cuts are not just cuts. They're also coming from reforms, very important reforms in welfare, for instance, or in in-home services. So there were good things that happened, but also it was, without any doubt, a tough budget, but a necessary budget.
Many governors do not support President Obama's health care bill because of what it will mean to their budgets. You do support Obama's bill. Why?
Well, first of all, I cannot say that I support exactly everything that is in the health care bill because I don't know exactly what is in that bill. It changes all the time, as you know. What I have said was, and I told this to the president, that I would support him 100% in healthcare reform because I think it's necessary. It's inexcusable that we have 48 million people in the whole United States that are uninsured. So I think we need healthcare reform, and it has to be done the right way.
Well, just to be clear, are you leaning towards supporting what the president has been talking about? I mean, he's put out lots of information. Which way are you leaning at this point, Governor?
I'm leaning towards reforming healthcare in America. And I think the whole idea of having everyone insured is a great idea. And I think it's also important to put a lot of emphasis on cost controls because we got to bring the costs down. I think that he's right on the mark on that one. And I also like his whole idea of prevention.
And what do you think about what it could mean to the tax burden? There are estimates that for the top level of Americans in their tax bracket, over 55% of their money could go to one government agency or another. I don't have to tell you, as a top earner yourself, how big a burden that could be. What do you think of that?
Well, first of all, I don't think that you can get anything like that done without paying for it. So we have to pay for it somehow. I think the trick is just to find a way of doing it so it makes sense.
Well, if that is the reality, that the top tier of earners in America is going to be paying over 55% in taxes, do you think this bill will make it?
I don't think so. I think that you have to come up with interesting ways of funding this health care. And we have, for instance, done different things here in California. We have tried to do, go to the tobacco industry and try to get some money from the hospital association, some money from the employers. So we kind of spread it and sprinkled the responsibility all over so that not one particular category gets hit too much.
There's a lot of politics going on here that may determine the fate of the bill. Let me play you some sound here of what the president said about what may be going on in D.C.
There are folks who think that we should try that, dust off that old playbook. What they don't recognize is that this isn't about me. It's about the American people. And things have gotten worse since 1993.
You're always honest about both political parties. Governor, do you believe that the Republicans are playing politics here at the risk of people's health care?
Well, hello. I mean, since when has there anything been done in Washington or here in Sacramento or at any capital where politics didn't play a big role in the outcome? I think that, yes, politics is in there. I think that it is very clear that it's a sensitive issue, and Republicans will use that if you raise taxes.
Of course, there's always politics going on. The question is it upstaging the need to help people right now? Is this getting to be a little bit of a reckless situation?
Well, look, I think that it is nothing unusual because every time you try to address big issues like that, you always run into this problem that people make decisions based on what's good for the politics.
Do you think the president needs to call out the lion? Do you think this takes your wife's uncle, Senator Kennedy? Do you think he needs to get involved for this to be successful?
Well, the question is if Senator Kennedy is capable to be out there campaigning because, as you know, he's fighting brain cancer. But I think that he was a very important player to get it as far as it is today. And so I think he has done his share. I think that now the people on Capitol Hill and the president have to pull it off and just, close the deal.
All right, Governor, thank you so much.
Well, thank you very much.